So we might have some folks join us in progress, just because, again, my reminder to folks was so late. I think we're going to have to figure out how to do a new sign up for an LEPC list because mine has so many bounce backs. It's just not funny. Our goal today is to start what will be a couple months long process of gathering feedback from a variety of different sources on the town's response to the COVID-19 pandemic. So we're hoping that we can do some gathering of information from town employees and town departments, from the school employees and the schools themselves, from the community at large, and as well as from elected boards and commissions, to try to understand what they feel the town did well in responding to the COVID-19 pandemic, and where they feel the town has room to improve. And hopefully there are lots of feedback in both areas, because I think there are some things we did really well, and I think there are quite a few things that we could stand to improve. We have a couple of external folks here, as well as some internal folks. So I'd certainly like to get both perspectives. And this won't be the last sort of opportunity to, provide feedback in the process. We're looking forward to doing this in a few different ways. And we do have a contractor who's going to be helping us out over the next couple of months do that process. What we're specifically looking for is feedback on a couple different areas. And I think I'm open to feedback in any area, but I really want to hear how people felt external communication was in terms of what information the town shared, specifically guidance in terms of like risk communication of how to keep yourself and your family safe, as well as information, how well we communicated facts and figures, whether people took advantage of some of the additional tools the town provided. The town, for example, did a revised website, which screen share for a moment. So the town had a COVID specific website that was the handiwork of Cindy and Kristen Scoble, primarily with other folks helping, certainly, that provided quite a lot of data in a sort of easy to read format. It provided focused updates. So this was really only about COVID-19, its impacts, its effects on town operations and the community. I found it really helpful. But again, I'm not sure everyone did. So I guess I'll throw it out. Whoever wants to sort of start, no need to raise your hand. You can just sort of jump in. What did people find was helpful in terms of communication? What do they wish there was more of? And then we'll go on to specifically how the town chose to do some of the things it did and why it did that. And I also realized that one of the things we've never quite gotten over is LEPC is first thing on a Monday morning, and no one really feels that awake on a Monday morning. So do your best.
Okay, I'll start because no one can ever shut me up. I like I liked most of all the coffee hour stuff that you and Tiffany and all of the crew did to answer employees' questions so that we can better answer residents' questions as well as our own. So it kind of gave us a better understanding of what was happening and what was true versus rumor versus what was happening versus what could happen, and gave us sort of a head start on what to expect.
Okay, great. I actually found those kind of fun, although sometimes it was interesting to see what questions you'd get. Just interesting to see sort of what's on people's minds, and someone who's focused 100% on COVID versus the questions you're like, oh, I didn't even know people were worried about that anymore. So yeah,
I think it lends itself to be when somebody has specific questions, because all of our situations are different. There's not one person who has the same concerns. And even though you have a list of questions and answers or frequently asked questions, it doesn't always quite answer what you're asking. And I mean, we all know Tiffany's awesome and she just answers it, you know, to your satisfaction anyways, until she knows you understand it. So that was invaluable.
Great. What about some of the other folks? Are there things that went well or things that could be improved in terms of public outreach and communication? One of the questions I definitely, oh, sorry, go ahead.
Sorry.
Yeah, Mark. Sure.
I just wanted to say that your availability, Tiffany's availability from a community media point of view was superb over the course of this past year. We utilized the heck out of you both for both our news and then also for, in general, our community bulletin board. And so we were constantly on the town website every week looking for the updates, getting the latest information from you guys. And one of the things that I really appreciated is that you guys were able to provide a hyper-local viewpoint of how the pandemic was affecting us. And I thought that that went a long way towards kind of easing the community's feel in terms of the fear factor of the pandemic. They get all sorts of news, basically from a regional point of view, from Channel 5, Channel 4, Channel 7. And those numbers get quite big and they get quite intimidating really quickly. And the fact that you guys were able to kind of calm the furor, so to speak, was extremely helpful for us. And I definitely appreciated that from both of you.
Thanks. I love getting compliments early on Monday morning. Are there things that we could have improved? What would have been additionally helpful? So Tiffany and I were brainstorming a little bit over email over the weekend. And one of the things that we were thinking of, Tiffany was wondering, and I think actually I'm wondering too, and Cindy, it might be something that's on your mind. Should we have used the emergency alert system, the Ray of Needham system, more often to push out information? It seemed like from our perspective, there was an emergency and everyone knew there was an emergency, and the emergency notification is sort of to snap people to attention, like, hey, there's something going on that you're not aware of. So from our perspective, we didn't feel like we should use it that often, but I wonder if people feel like they were kept informed enough. Should we have used it more regularly, or was it the right amount?
So just from my perspective, I think, there's always a balance between using it to alert people and, like you said, sort of snap people's attention versus using it so often, like places like Somerville do and some other communities that use it all the time, and you stop paying attention to what might be really important information. There may have been one or two other times we could have used it, but I think the frequency felt right to me. And my understanding, having only been here for a couple months before COVID hit, we did use it more than we had in the past. So, yeah, I think that for me it felt good, but I'd be curious what others thought.
And for those who joined late, I'm sorry for the very late reminder. I don't have an actual LEPC email list, or I have one, but it has names from a very long time ago, including like many retired police and firefighters. So I did not send out a reminder until about 2 minutes before the meeting. Maybe that's even generous. It might have been 1 minute before the meeting. We're talking a little bit through what went well and what didn't in terms of the town's response to the COVID-19 pandemic. This will be the first of a couple of different opportunities to get feedback from internal town employees, from school employees, from the community at large, from businesses. So we're looking for what went well and where there's definitely areas for improvement. Right now we're focusing in on sort of communications and emergency notification.
Tim, one other thing on the use of the Alert Needham. So a real benefit to having this system in place during a crisis was we were able to actually grow the users of Alert Needham to something close to 7,000 people, which when we started was something around, I want to say 1,000. And so what's nice is we now have that group of people going forward when we have other situations where we need to alert the public. We have those people, and I'm not sure without the pandemic, we would have been able to grow the list as rapidly and as largely as we were able to.
Sure, and I think that's valuable from my perspective. For example, as health director and assistant EMD, when the town had a sort of false positive for water contamination a few years ago, and we had to wait for the second confirmatory test before we issued the boil water order. That's the MWRA's protocol, but we started to get a lot of our messaging in place. We started to get a lot of our plans. We found out at like 3 o'clock or 3:30. Sean, I think you might be here by then. Like 3:30 on like a Tuesday or Monday, I think. And we were going to find out by the next morning, next like noontime, basically, whether it was actually a contamination in the water, which would require boil water, or was a false positive. And when we were talking about being ready, and we had pre-scripted some of our messages for emergency alerts, Cindy, the question partially was, is there really any reason to do so? Because we're hitting hardly anyone. There of course was, but yes, it was hundreds of people in a community where there's, more than 10,000 households. So, when we're talking about a no notice event or an emergency event like that, having people who are already subscribed to the emergency alert system is a real benefit. So that is one sort of ancillary positive that certainly came out of the COVID-19 pandemic. Mark, not to pick on you since you were one of the people who were kind enough to sort of volunteer thoughts, but where do you think there was areas for improvement in terms of information that was shared or the frequency of information sharing? Any sort of feedback on where we could improve?
No real feedback on that front. I thought that the level of information was good. The timing worked out really well for our community bulletin board. The release, if it were a little bit earlier in the week, would have been a little bit better for our newscast, but that's, splitting hairs. That's not a big thing. There was 1 or 2 times I would say that, say when there was a case or something that popped up in the Needham Public Schools, where it would have been nice to get that information a little bit more quickly, but whatever didn't come through did come through Dan Gutekantz's office. So I think that provided good coverage. I appreciate the fact that Alert Needham was not used too often on that front, because I think that there were enough other venues for that information that there was no real need to utilize the Alert Needham. It would have caused more, as I said, more panic when it would not have been necessary. So I think overall things went very well.
Thanks. Okay.
I think one thing I wish in regards to Mark and his team is that we had reached out more often, because we do that on the regular with different things like DVAC and stuff. So from a personal level, I wish I had the brain power to think we should really get on top of it before they have to ask us.
Yep, I think that's a very fair point. We do obviously have a good relationship with the Needham, with Mark and his folks. So yeah, I don't think you or your staff really hesitated to sort of call us and follow up and say, hey, we really want to have a story. We really want to talk to you on camera. But yeah, I wish we had, like you said, maybe prioritized a little bit more. We should call them and say, hey, we want to get a story out, or hey, there's this important announcement.
Although both Ashley and Mike, they're not shy people, so
that's true.
They feel very free and they feel very comfortable reaching out to both of you whenever they do have questions. I would imagine, just from the other perspective, if there was a message that the town wanted to put forth, then that would be important to reach out to either myself, Mike, or to Ashley, and we would have gotten that information on out.
Definitely.
Can I ask a question that is somewhat not COVID related, actually, but related in terms of messaging on like the Needham channel and things like that? So as somebody who does not obviously live in the town, and I have not actually stepped foot in the town for several months at a time over the past year and a half, working from home. So I'm only there occasionally. But how does somebody who doesn't work in the town, who doesn't live in the town, but works in the town, so I'm interested in what's happening in the town see the Needham channel. Like I know I can see my local town coverage on a local channel on my cable, but I can't necessarily see Needham's. So how does somebody who doesn't live there do that?
Sure. There are several different ways. Mostly it's through our streaming channel, which is on our website, which is needhamchannel.org. You can watch one of our channels there, and all of our programming gets cycled through that, so that people outside of Needham can get that sense of what's going on and keep up to date with what we're doing. And then also through our social media, we do continue to do Twitter, the Facebook, and Instagram to get information out as well. We utilize those channels.
Okay, good to know. I'm just curious because I did have one question randomly at one point for somebody asking about, I vacation or I'm somewhere else during the pandemic. How do I know what's going on in Needham? And I was like, well, you can watch the channel. And well, I'm not in Needham, so I can't do that.
Right. Yeah, but our website is, again, one of the best places to actually watch our channel, no matter where you are. And we will continue to air our live programming on that way too. So if something is happening immediately, we utilize that streaming capacity so that people can watch it and tune in live.
Okay, great.
Thank you. Maybe I'll cold call a little bit. Dale, from your perspective as both a community member and as a member of a town board, the Commission on Disabilities, what did you think worked well in terms of messaging to the public? Were there areas you thought we could improve? Any sort of constructive feedback?
Yeah, to be quite honest with you, Tim, I seldom went in to look at it. So I really can't give a perspective. When I did go in, I was pleased with what I had. And normally I followed information on through the newspaper and stuff like that, but I really don't have any pros or cons or suggestions there.
Okay, totally fair.
Thought.
Sure.
Yeah. So as far as the messaging and how Needham put out information, especially to those of us that were set up with the technology, I thought was outstanding. I looked at my local community. I look at, which is Framingham. I looked at Wellesley's. Most did a good job. I think Needham was outstanding. And also because we're at the Department of Public Works, after we went into the pandemic, took a breather for 2 weeks with everyone. When our operational staff got in that didn't have technology, the Board of Health did a great job, and Tiffany coming down to answer all their questions, calm, respectful, because a lot of our staff that was in, it was 50-50 for a while, then we did a little bit of full strength operating at 2 different places, trying to social distance, did a great job talking to the staff in person to keep a calm. Sorry about that. So I thought that was outstanding, and it was very respectful, which took the edge off the staff. The operational staff actually had a lot of concerns. This whole thing was emotional. So we have the facts thing, but there was also an emotional component where people were afraid. I guess the fear factor, and it dragged on for quite a while. So none of us has experienced this. And I think Needham did a great job in talking to our staff. They felt we took all the protocols to keep them safe in a respectful manner. So I think Needham did a really good job. Somebody keeps calling my phone. So kudos to that leadership and the Board of Health. And I've talked to other communities, so I think you guys really led the show on that, and through HR to get the information to the staff that didn't have the technology. So there was also that communication in person. That was terrific.
Thanks, Ryan. We appreciate that. One of the things that I thought was a nice feature, and it was kind of behind the scenes on the town side, was that Eddie Sullivan, who's the fire department's EMS coordinator,
I'm on a meeting.
worked to set up a process where there was an occupational exposure for a town staff. So a maintenance worker in a building, whenever there was an occupational exposure, instead of trying to sort of send that person to community CIC Health in like Kendall or in Riverside, Eddie got sort of arrangements so that they could do the testing. Needham Fire could do the testing. They'd send it out for lab results. It would be quick. The cost could be charged to the employee's department. And that worked out, I think, very well. I don't think it was used a ton because there weren't a ton of occupational exposures. Dennis or Tiff, do you guys have a sense of how often it was used?
A rough estimate, probably 30-ish times.
Yeah, I would say probably about that many. We use it a bunch initially with our people, and then, yeah, probably around 30-ish some odd times. It sort of seemed like, unfortunately, by the time we got that up and running, the widespread infections were starting to slow down a little bit, and vaccinations are starting to kick up. So it sort of was like, I don't want to say near the end because I don't know if we're at the end, but it was near to the beginning of the end.
Sure.
We also sent school folks to the fire department, which was
Yeah.
really helpful.
Yep.
That was great.
Yeah, I think that was a really good example of the town sort of adapting to the challenges and offering a good service. Cindy, you have your hand up.
Yes, I have to jump off in a minute, but I wanted to just mention one other thing that I think was great and I hope continues in some fashion. The Council on Aging and Aisha's daily email out to the seniors who are obviously the most vulnerable population was fantastic. And I know so many people relied on that, not only for information, but also for social interaction, as a lot of these seniors were the first ones locked down in their homes. And so I want that on record because I think it's been fantastic. And like I said, I hope there's some way it can continue going forward.
Great, thank you. Justin, you had your hand up.
Sure. Thanks. My apologies for, I didn't realize there was a meeting today. I would have had some notes prepared, but I mean, from my perspective overall, from a comms as a resident, I actually think that the town did a pretty good job. And I say that with the perspective that I ran the COVID response for my organization at Novartis in Cambridge and to some extent the US. So I kind of seen and having to be responsible for the communications, seen that. Yeah, I think in the beginning it was chaotic, sure. It was chaotic for everyone. There was orders, advisories, who has power to do what. There was, I think people were trying to feed information to people. They're never going to be satisfied. I say this from the perspective of also being one of the moderators for the town Facebook site or the non-town unofficial Facebook site, which wants me to, I don't know why I still do that, but and you find out that people are never satisfied at whatever level of communication is out there. There's somebody who's always going to want to be more because they sometimes see Brookline's Facebook site and so therefore they believe that Needham should be like that. But nonetheless, I think there were some I wouldn't say challenges, but perhaps not enough information onto why Needham chose not to disclose certain information, which caused certain people to be, there was an incongruency between other towns and municipalities and jurisdictions that would do that. I think it was perfectly fine that Needham did what they did, but perhaps it wasn't, that message wasn't carried out, that the reason why. And to some extent it will never satisfy people, but it would satisfy, I think, some folks, rather than having to hear it from Tim reporting to the Board of Selectmen on whoever could dial in, or whatever it may be. There's an appetite for this information. People do have they're not they're not locked in reality, and I think they want to be spoon fed. But nonetheless, I think overall the town did a really good job communicating. After things got structured, I agree. Alert Needham should not be used for this type of an event. This is a slow burn, and that really is meant for more of an acute incident to get people boil water, etc. But nonetheless, yeah, that's kind of what I have at the top of my head. I can kind of probably write down some more stuff and submit that.
Sure. I think this is our first blush at our first pass at getting feedback from the public. So it's going to be a broader, hopefully, effort to get information. One of the things Justin's alluding to is at the beginning of the pandemic, and we didn't do a good job explaining it. The State Department of Public Health has, and I guess I'll say it's a rule, although there's nothing really binding on people. It has a rule that if there are fewer than 5 cases in a community that's under 50,000 people, that you should not disclose the number of cases because it could be, they believe, individually identifying. So that, if you say there's 1 case in the community, people will figure out who that 1 person is because of the size of the community. That's not an issue in the city of Boston or in much larger areas, but in a fairly small community, if there's only a handful of cases, they worry that we can tell that it's, Tim and Chuck and Taleb who have particular situation with a communicable disease. We didn't do a great job explaining that, and other communities chose not to follow that. So there was a lot of public pressure about why is this not being disclosed. I think there was also some speculation that we have, dozens and dozens of cases at the beginning of the pandemic, and I think at that time we had 2 cases. So it was a little frustrating being on the inside, but I think it also spoke to why we needed to have a better plan for how to communicate that information. From my own perspective, and I know she signed off, Cindy caught a lot of flack for decisions that were mine or were the health divisions. And people think that Cindy was always the one advocating for disclosing more information. And so I felt that was pretty unfair at times. It was hard for us to get out and correct the record, and we obviously don't want, health division disagrees with, public information officer on what to disclose to be the story. But I always felt a little bit bad that Cindy would get so much flack from the community Facebook group when she was always pushing to disclose more information. We want to disclose quite a lot. We have a lot of concerns, obviously, given our job and our role, if we think that something could identify someone as having a communicable disease, especially very early in the course of a pandemic. So that was a balancing test that I think we really could have improved on, and hopefully we can take some of the lessons we learned this time and improve on it for next time, which hopefully will be when I'm long gone. Other folks on the call, thoughts about what might have gone well, what didn't go well? I know we have, and I certainly didn't tell him we'd call on him, but I was hoping maybe to get Christian's perspective from MEMA about the information that we shared and kind of the interface with state emergency management in the context of the pandemic. I know that MEMA was largely in sort of a assisting and logistics role, and that it was a slightly non-traditional response on a state level because there was the COVID Command Center, which I think we could charitably say used a different form of ICS.
Hey, Tim. Sorry, I'm on the road today, so I don't have my camera on. No, in regards to Needham and MEMA's interface during this, you guys were exceptional, especially with the turnover and Michael's departure. The lieutenant of the fire department, Tim Taleb, and the other staff, it was excellent working with you folks. And obviously MEMA has a number of items and needs improvement areas, but overall, I think on our logistics front, we stood up in several warehouses, pod sites across the state, and we're extremely successful in pushing out PPE to schools and public safety and all of the other ancillary, town department. overall, I think Needham's communication with MEMA was extraordinary using WebC. And I think you guys were definitely a model for our, at least, our region in regards to communities that had their ducks in a row and were prepared for at least to extend. As Tim mentioned, MEMA was not involved in the public health side of things. Obviously, that was DPH and HHS, but no, extraordinary job overall. And we look forward to continuing to train more folks from Needham on WebEOC and continue that depth of bench that we saw in COVID. So,
thank you, Christian. So I know that Talib and Chuck are both on, and both of them assisted at various points in making logistic requests to MEMA through the WebEOC system. And Christian mentioned that the primary role of MEMA in this emergency was logistics support and supplies and staging. Chuck or Talib, from your perspective, how did that work? What did you think went well in terms of how we could request resources?
Yeah, from my side, I would like to take this chance to thank you very much, MEMA and National Guard. They have done a great job. They answer our calls. In time matters, our requests. Kristen, thank you, Kristen. Because Rebecca, she left and she trained me quick and she did a great job. So I was a little bit confusing how to use the AOC, WebEOC. So, but Kristen, he was like correcting how I put the data, about the amount, the quantity. It was great to work with them, and they did a great job. This is my feedback.
Okay.
I agree. I didn't do too many because I split duties with others, but I found it to be very user friendly. And anytime there were questions on further information needed, the staff at the state reached out and just asked for that follow up. So it was a really smooth process in terms of putting requests in. So
great. Yeah, I felt that part went well. I think Dennis, Needham Fire and Needham Police were the primary beneficiaries of some of that logistical support early in the pandemic. But Chief, from your perspective overall, what do you think were some of the town's strengths, and where do you think there were areas for improvement?
I think overall, our strengths were definitely the coordination ability of the town to get everybody on the same page as quickly as possible. And I don't know if we had any real internal weaknesses. I think another one of our strengths is an awful lot of ability and willingness to do more. But we were hindered, I hate saying this, by state thoughts and opinions on how this should be run. So we could have done, I believe, more vaccinations. We could have done the testing earlier if that was made more available. Instead of that was kind of like a piecemeal, one town did it and then another town. So like, I think overall within our community, I think we did very, very well in all angles, in all aspects of this. So I can't really point to any deficits that we had. The state was good at getting PPE out early on. Maybe not in the very first days, but very shortly after that. So in a lot of ways, they did a good job. I can't say they did a bad job. I just feel like we were hindered to do more. And that was maybe something that in the future could be addressed, but I don't know if that's addressed within us.
I think, and we obviously it's a public setting, so we're not going to focus too much on our frustration with the state. But from a local level, we felt the state had a complex situation to manage, certainly understood, but made commitments to locals and then changed them quickly, would announce something that would affect locals in terms of, okay, now you need to do inspections and enforcement and issue fines. And by the way, we're telling the news before you're getting told. So then you get calls saying, how are you going to enforce this? What are you going to enforce? Who are you going to give fines to? I think that the state, I don't know if it really focused on how to work that well with the locals in many instances. I know, and I won't certainly, even though she's retiring, so Barbara might have no reservations anymore. But Barbara, from your perspective, in terms of the information that school health got from DESE and from DPH, how did you feel that information went? And did you feel like you and your team of nurses were, well positioned with the information, or did it make it a little challenging sometimes?
I will just say I agree with your comments on our end as well. It was a challenge to keep up because sometimes we found things or received new information very suddenly and not always most convenient times. So I will say at our local level, we've so appreciated all of you because that's really helped us to help our community.
Thank you. We were fortunate certainly to work with Barbara and her team of nurses on a lot of aspects of the pandemic. So, the fun parts were at the end with vaccinations, but there was a lot of work with contact tracing. There was a lot of work with guidance around distancing and masks. The schools, and it's probably a little bit beyond the scope of our discussion here, but the schools, we do actually have Shannon here. The town and the schools put a lot of money over the last summer, into improving the ventilation and the HVAC systems at every building, buying air purifiers, buying higher level HEPA filters, upgrading fans and blowers. And I'm going to rapidly extinguish my knowledge on what the HVAC terms are, but the town put a lot of money into ventilation. And from my perspective, it feels like that was a worthwhile investment. Dave Roach, you had your hand up.
Yeah, Tim. So kind of going back to what the chief said a few minutes ago, I think it was, and by the way, the information you guys sent out, I think was great. I think we had everything we needed at the beginning to try to figure out, what to do and what was the safest way to do it. And I appreciate that. I think at the beginning, we really scrambled for, it seemed like weeks to get supplies, get masks, get cleaning supplies. I know that it came down that from the state, basically who they considered essential. I felt my people were exposed, during the inspection process, and I would hope, and I think our association is going to probably take it to the state level where inspectors actually should be probably considered in that group. I think we should have got vaccinations long before we got them, and we ended up going out and getting them on our own for the people that really wanted to get them. So I guess that was the frustrating part for us. We never stopped through the whole pandemic as far as going out. We limited some inspections, but my people were exposed during that whole period. So that was a little frustrating for us.
Sure, absolutely. Yep. I think, there was an interesting, distinction that a lot of departments went remote, partially or fully remote. There were only a handful of departments, and public safety obviously is amongst them, that never, went remote by the nature of their work. But your point that, your inspectors were still, in the field, they weren't doing virtual visits. That they did have a high degree of exposure, especially, as we were learning more and more about the pandemic in the spring and early summer into the fall. High degree of exposure for people who were physically on site and had to have those face-to-face interactions.
Tim,
Other
if I
folks,
might add a little bit.
Yep.
That's a good point that Dave brings up about, they should be, and perhaps more people should be considered essential in town. But the ability that the town had to make things work was exceptional, truly exceptional. A lot of people are working from home and remotely and so forth, and people coming in, only maybe 1 or 2 people in the office, but the town worked, and it did very, very well. Town meeting was conducted twice outdoors, which is remarkable. All the committees and groups kept meeting. I know with our building project, the PBBC met twice a month during the whole thing, and nothing was delayed. So I give great kudos to all those people to really make things work. And with the inspectors on our end and Dave's, they worked well together. And I don't think any of the contractors were lacking in time, with their projects because of the town slowing things down because of the pandemic. So that was a great achievement.
Right. I know, some people on this call and a number of other people in the town worked very hard to make, and you'd think it wouldn't be that hard, but there's a lot that goes into town meeting and the logistics around it. And there's sort of a lot that has been formalized and put into practice based on the setting. And so changing where it is and how it works is not nearly as easy as it maybe should be. But people worked hard to make that happen. I do realize we've had folks for almost an hour. Are there other comments or questions or suggestions?
Comment.
Yep, Ryan.
I just want to resound what everybody said. Public safety was in, the building, others really did a good job, because I think locally, Board of Health and Town Hall did not overly politicize this thing. Most of the concerns from my staff and others, because everybody watches TV, the federal government did a horrible job, in my opinion. They used it as a political football, and that is what caused most of the anxiety with our staff that was in. And Needham did a very good job at the local level, putting out facts, and didn't use it as a political football. It was too important. So I think that's important. I think the confusion from the federal level and the huge media outlets was disgraceful. Caused division and anxiety. That there was already a lot of anxiety. So I think that's something that in my organization, I'm going to keep putting out, that the local groups did a great job overall, holding it together.
Okay, thank you, Ryan.
I have to echo that, just being a town meeting member and, being able to have town meeting, being able to get my dog license, in February without a hiccup. Like I said before, I think Cindy, did a very good job getting information out. Like I said, there are people that will never be satisfied, and that's fine. But I think that it's a tremendous effort, in no small part, to all of the departments working together and adapting to a very dynamic situation. I was able to get my filing for my home improvement project, without a hitch either. I shouldn't say home improvement project; it's a massive renovation, but nonetheless, able to get inspections in and stuff like that. So that's the town did not stop. Certain aspects of the community did. My kids went to school, as well. So that's a testament to everybody. So thank you.
Thanks,
I
Seth.
also want to point out that the building department did an amazing job rolling out their online permitting in the middle of the pandemic.
You're here, yeah.
It literally rolled out the Monday after we all got sent home. And they worked tirelessly, as well as the other departments that we've brought on since, but it's been a challenge because it didn't roll out anywhere near like what we had intended it to. We wanted to have in-person training and things like that we just weren't able to do, and they kind of rolled with the punches. And it's still a learning process, as any new software would be, but they worked with the public to still allow the town to realize, you know, the income from those kinds of activities, which is necessary to keep working, but at the same time, it's a new process. So it's something that the public wasn't prepared for, but to have your staff also not be able to prepare sufficiently for it was a challenge that I can't thank them enough for being open to everything. And I mean, I know I speak for myself, and Terry, I'm sure, would concur that the building department, I mean, we probably sat there for what, 8 months trying to go over all the stuff that they needed and make sure they had what they needed. And still there was stuff every day that came up that was a challenge. And I don't know that those challenges would have happened if it wasn't also in the middle of a pandemic. So to that end, building was amazing as far as learning how to use the new stuff. Second to that, and not by any means less than that, the actual town's position on working from home and allowing people to do those things. And if your job, I mean, many jobs in town, like the fire department can't work from home, the you know, water and sewer can't work from home. Everybody can't work from home, so your job doesn't always allow it. But for those of us that did have jobs that allow us to work from home, it allowed people that sense of comfort. And HR being available to make those changes and make those things available was immensely helpful. And from my perspective personally, was beyond grateful to work for someplace that has that perspective, that your employees are just as important as the public. So I appreciate that too.
Thanks, Kim. Unless anyone else have any last comments before we wind down? As I said, this will probably be this is the first of more than a few efforts to get input from town employees, from school employees, from the general public, from boards and commissions about what went well and what didn't, to inform a sort of a town after action. Barbara?
I really just want to thank you all for your partnership, collaboration. It's really been so helpful and so appreciated. I know it's not like this in other towns or districts, just from speaking to my colleagues. And so I'm forever grateful. You're a really great group to work with. So thank you.
We're going to miss Barbara. Barbara is retiring, much to our dismay, but happiness for her. She's been a great partner with the schools as the director of schoolhouse services. So it's a sad day in public health when the end of the school year rolls around in a week or so. All right. Well, thank you very much, everybody. Appreciate you joining us. Appreciate giving feedback and helping the discussion. All going to be part of trying to come up with a good after action report and improvement plan so the town can be better prepared for the next emergency. Thanks very much. I hope you have a great day.
Thanks, everyone.
Thanks, you too.